Breast. Men like to look at them and women think they are a pain. Women were given breasts for one reason, and that reason is to feed their children. After spending 9 months in a mother's womb, it is extremely important that after a baby is born that they are well nurtured and protected. You as parents have two choices when it comes to feeding your newborns. You can breastfeed or formula feed. The best way that a mother can nourish and protect her newborn is by breastfeeding because it creates a bond like no other between mom and baby. During pregnancy, your breasts tend to swell and fill with milk. The first secretion from the mammary glands after giving birth is colostrum. The American Pregnancy Association states that colostrum is low in fat, high in carbohydrates, protein, and antibodies to help keep a baby healthy. Colostrum is extremely easy to digest and therefore the perfect first food for your baby. Colostrum has a laxative effect on the baby, helping him pass early stools, which aids in the excretion of excess bilirubin and helps prevent jaundice. Breastfeeding is not just beneficial for your newborn. The American Pregnancy Association also states that it contributes to postpartum weight loss and suppressed menstrual periods, which help to replenish iron loss during pregnancy and childbirth. It can also help prevent against more serious illnesses like osteoporosis and breast and ovarian cancer. When your baby is breastfed early and often, your breasts will begin producing mature milk. Frequent breastfeeding also helps prevent engorgement, which any of you mothers know can become quite painful if not alleviated. Your colostrum provides not only perfect nutrition tailored to the needs of your newborn, but also large amounts of living cells which will defend your baby against many harmful agents. The concentration of immune factors is much higher in colostrum than in mature milk. Colostrum actually works as a natural and 100% safe vaccine. Some mothers choose to feed their newborns prepared milk that one can buy from the stores. While companies like Gerber, Similac, and Enfamil have come extremely close to reproducing a mother's milk, there are certain immunities that the mother has built up which can be transferred to the baby during breastfeeding. Breast milk contains large quantities of antibody called immunoglobulin, or IgA. IgA protects the baby in places most likely to come under attack from germs, namely the mucous membranes in the throat, lungs, and intestines. Store-bought powder does not contain any of these immune factors. Colostrum has an especially important role to play in the baby's gastrointestinal tract. Colostrum seals the holes by painting the gastrointestinal tract with a barrier which mostly prevents foreign substances from penetrating and possibly sensitizing a baby to foods the mother has eaten. Colostrum also contains high concentrations of leukocytes, which are protective white cells which can destroy disease-causing bacteria and viruses. The colostrum gradually changes to mature milk during the first 2 weeks after birth. During this transition, the concentrations of antibodies in the milk decrease, but the milk volume greatly increases. The disease-fighting properties of human milk do not disappear with the colostrum. In fact, as long as the baby receives milk, he or she will receive immunological protection against many different viruses and bacteria. There are many joys that come with having a baby, and there are also many fears. The fears and anxiety of having a baby can sometimes disrupt the process of breastfeeding. If a mother is anxious, the milk may not drop, therefore the baby will not get anything once they latch on, if they latch on. According to Medline Plus, mothers often discover the hardest thing about breastfeeding is getting their babies to latch onto the nipple. La Lache League International suggests that the mother relaxes herself prior to breastfeeding. If you find that your newborn is having trouble latching on, you can still provide breast milk by using a breast pump. If you have any questions about breastfeeding, your local hospital has a lactation specialist that will always be more than willing to help. As a breastfeeding mother, you will never need to warm a bottle or spend a dime. Bottom line, there's no good reason not to breastfeed your baby. The bonding experience as well as the nutritional value that is provided for the baby by breastfeeding is truly beneficial.